Hello students, welcome to IMP PYQ series. Today we are doing Dengue. Dengue is generally asked, very important, etiology, transmission, pathogenesis and classification. So first we'll look at the introduction. See, dengue is an important viral fever because it can range from a simple febrile illness to a severe bleeding and shock. What is the definition? Dengue is an acute mosquito viral infection caused by dengue virus and transmitted by Aedes mosquito. Okay, what happens is that Aedes bites spread dengue virus and can cause fever, low platelets, and sometimes plasma leakage. So, this is something which you might have already know because dengue is a very big problem in India. So, let's look at the etiology and virus group. Dengue virus belongs to flavivirus groups and is a RNA virus. And like I told you, every dangerous virus is a RNA virus. Let it be AIDS or anything. But the important point is there are four serotypes: DEN1, DEN2, DEN3, and DEN4. Just remember the name, this much is enough. Why this serotypes make it more problematic is that infection with one stereotypes only gives immunity to that same stereotypes. This I will explain in the pathogenesis part. Transmission vector spread by Aedes mosquito. Biting habit. The differentiating factor is that the dengue mosquito usually bites during daytime, and this is why dengue is common in urban areas with stagnant clean water collections. So, what is the pathogenesis? Entry of virus. After the virus, the mosquito bite, the virus enters the blood and infect target cells. The primary effect is that it produces fever, headache, and body pain in the initial phase. Now, if the infection occurs again, this is called secondary infection. What happened is that primary infection was with the serotypes, suppose DEN1. So, body will only produce antibodies for DEN1. So, if in the secondary infection, which occurs due to DEN2, the body will not be able to fight against it. That is why dengue becomes so dangerous. Okay, and it shows antibody dependent enhancements. What happens is that these virus enters into these antibodies help the virus enter the cells. Okay, virus is already present in the blood. Now, with the help of antibody dependent enhancement, these viruses are able to enter cells and cause severe complications. What happens is that it leads to vascular permeability. And what will happen due to vascular permeability, you simply know as something which is able to go through. So this will lead to plasma leakage. Okay, the result is that the patient may develop hemoconcentration, thrombocytopenia, bleeding tendencies, and shock. Hemoconcentration simply means our blood is made of two parts, plasma and non-plasma. So if the plasma moves out, the concentration of other ingredients of the blood will greatly rise. Thrombocytopenia, you already know, decrease in platelet 5 because these are able to destroy platelets, and platelets are required to prevent bleeding, to control bleeding. Okay, this much is enough. Let's see the clinical classification. You have to write clinical classification if it comes as a LAQ. Even if it comes as a SAQ, just write the names and add one line. But if it comes at 10 marks, add a little bit explanation. First, you will get is a dengue fever. Dengue fever, the features are high fever, severe headache, retroorbital pain, myalgia, arthralgia, and rash. Basically, this is the classic febrile form and also called breakbone fever because of severe body pain. You might have heard dengue patients complaining that all their joints are paining, which is called arthralgia. And even their muscles are so sore that they feel their whole body is breaking down. This is one type, which is dengue fever. Second is dengue hemorrhagic fever. This is second severe form, dangerous than simple dengue fever. Here you would get fever, thrombocytopenia, decreased platelet count, and due to that bleeding manifestation along with evidence of plasma leakage. You might have heard people getting plasma injected into their blood. This happens in DHF. Okay, disease becomes very serious because vessels become leaky and bleeding does not stop. So we have to give vitamin K, which helps in clotting, transamic acid. The whole treatment is required to make the patient stable. Third is dengue shock syndrome. This is where things become fatal. Why? Because there is severe plasma leakage, and due to severe plasma leakage, there is hypotension. Whenever there is hypotension, this means circulation issues there, leading to weak pulse and shock. This is the point where you might have heard that that particular patient died because of dengue, because DSS is that. So always write dengue fever, then dengue hemorrhagic fever, then dengue shock syndrome. Now let's see the laboratory diagnosis, otherwise this lecture will never stop. Always the test which is done is NS1 antigen. It is detected in the early phase, especially in the first few days of illness. So suppose a patient comes with thrombocytopenia and symptoms matching dengue, the first test you need to do is NS1 antigen. This is quite effective. Then you will go for IgM ELISA. IgM, you know what is it is the Mumbai police. And what does Mumbai police do? It is the first responder. So if IgM is present, it suggests recent infection, and you will look for IgG. IgG appears later, generally when due to past infection or secondary infection, the antibodies are already paid. Okay, so if you see IgG, that means infection is old. Also, along with that, you have to do CBC because you need to maintain the platelet count which comes in CBC. So you will get thrombocytopenia, leukopenia, and raised hematocrit in a plasma leakage. These are all first year tests, and you might be very familiar with them. So low platelets and increasing hematocrit along with NS1 antigen are used. Okay, that is why we say CBC is the gold standard of all blood tests. There are a few key points since it is a long lecture, so which you need to remember that dengue virus is the RNA flavivirus, serotype 4 serotypes, and each serotype will create immunity only for that serotype. Vector is Aegypti mosquito. Danger sign when there is severe plasma leakage. Okay, lab you have to see NS1, IgM, and IgG. One line memory trick is NS1 first, IgM later, IgG later. And severe dengue means plasma leakage. So I think this much is enough. We have quite done it quite detailed. See you in the next topic. Thank you.